The Mbale network of young people living with HIV/AIDS has called on the government to increase funding for HIV services following the withdrawal of US support through USAID. This was at the annual meeting in Mbale.
Review meeting at Mbale District headquarters, MNYPA Executive Director Peter Mwero expressed concern over limited government funding. He noted that although the district increased its HIV service budget from 0.4% to 0.5% for the financial year 2024-2025, the allocation remains insufficient.
Following the executive orders from President Trump, we have seen some of the USAID partners are freezing funding. And now it means that for us as the Mbale network of young people, actually this is the time for us, we need to push government to ensure that it takes over some of these expenses in terms of health, in terms of procurement for the drugs, in terms of procurement for HIV prevention services, and even including the sexual reproductive health services like PAC.
Mwero highlighted the valuable role of community health workers in providing services, but warned that without adequate funding, young people could miss out on critical care.
If the reduction of this funding continues, it means that we are going to be in a community where we have very few health workers, people like the YAPs, the adolescent peer supporters, people like the mentor mothers, they're not going to be there.
Efforts has to be done in community sensitization. So the district should allocate enough funds to ensure to facilitate the people who can reach to many young people in the communities.
Robert Wandwasi, the district AIDS focal person, reported that peer educators have withdrawn due to lack of facilitation, disrupting services for young people living with HIV/AIDS.
Most of these peers were supported by the budget from USAID. So definitely these younger people now, most of them have gone back to their communities and they are not really supporting us at the facility because we can't be able to facilitate them given our small budget which comes to the facilities.
Meanwhile, District Planner Magomo Abdallah revealed that Mbale has launched a nutrition action plan for people on RVs to help them live healthier lives.
We have put aside some money for nutrition. And we have a nutrition action plan, a district DNAP, for 5 years, where we are logically implementing activities towards feeding.
One was also urged parents to use the holiday period to speak openly with their children about HIV, noting that only 42% currently engage in such conversations.
Our parents, please have some time, have some quality time talking to your children so that they can be able to get this message seriously.
Stakeholders believe that with increased collaboration and government involvement, Uganda can achieve its goal of eradicating HIV by 2030. Story compiled by Muhammad Iga for UBC News.